Welcome back to Road Gang Radio. Join Jimmy Mack and Lindsay Lawler's Gang of the Airwaves by subscribing to Radio Nemo on YouTube.
We celebrate all kinds.
Make it official. After all, if you're listening, you're already in the gang. The Road Gang.
Welcome back, by the way. One of the most important segments we do on the show is Highway to Health. It's something that Claire Marie and Dave started a long time ago. We continue that tradition on Road Gang Radio. What we're talking about today, by the way, is insidious. It is one of the most insidious diseases out there, and some good friends of this show actually suffer from it. It can lead to inflammation, and that in turn can damage various body systems, including the joints, skin, kidneys, blood cells, brain, heart, and lungs. It is insidious, and it's lupus that we're talking about, and we have two great people to have that discussion with us this morning on Road Gang Radio. It is our absolute pleasure to welcome to the show Dr. Dantata and of course her colleague, and we are thrilled to have them both here this morning. Wendy Rodgers, Director of Care Support and Services, the Lupus Foundation of America, and I'm literally getting tongue-tied this morning, Dre. It has been that kind of morning. Khadija Dantata and Wendy Rodgers join us this morning. Welcome to you both.
Thank you. Thank you so much.
What we'll do, guys, is I will make sure that it doesn't turn into a Howard Hawks movie. I will actually use your names. I will say Doctor or Wendy, and that way you'll know who I'm talking to, and we won't kind of get on top of each other. Doctor, welcome to the show. Can you kind of unpack for us what lupus is? Give us the 30,000-foot view.
Thank you so much. Thank you for having me today. My name is Khadija Dantata, and I'm one of the health education specialists at the Lupus Foundation of America. So I'd like to highlight what lupus is. Lupus is a chronic autoimmune disease that can damage any part of the body. It happens as a result whereby the body cannot differentiate between healthy cells and tissues and foreign invaders to the body. So this means the body is attacking itself. It is a heterogeneous disease, meaning that this disease may vary from a person to person. One person may complain of for example, joint pain as their most difficult symptoms of lupus. Another person may complain of fatigue as their most difficult symptom. This is a brief overview of what lupus is.
Yeah, and it's one of those things too that a lot of people have heard. They've heard the term, all the time, and don't really have a sense of what it is it does. And I use the word insidious because there is a good friend of this show who actually is a sufferer from it. And can you kind of talk also as well? And then I got a question for Wendy. Can you kind of talk as well about how it manifests itself, when it manifests itself, and what kind of quality of life changes it begins to kind of, affect either immediately or over time?
So thank you so much for that question. Unfortunately, lupus can affect any organ system of the body. And depending on the organ system affected, that's what the type of symptoms the person may present with. For example, when lupus affects the brain or the nervous system, a person can present with symptoms like confusion, seizures, psychosis, and even depression and anxiety. The gastrointestinal system, or the system that surrounds the stomach and the intestine, can also be affected by lupus, and the person may present with symptoms like nausea, vomiting, diarrhea, and even weight changes. In women, the most common presentation when the reproductive system is being affected by lupus, they may present with symptoms like menstrual irregularities. They may even have pregnancy complications, miscarriages, and so on. A very important organ that the lupus may affect is the kidneys. And this is when we term it lupus nephritis, when lupus causes inflammation to the kidneys. And a person may present with symptoms like swelling of the face and legs, foamy urine, and that is a very, very serious manifestation of lupus that needs to be addressed promptly. The largest organ in our body, the skin, is also being affected by lupus, and the most common presentation is the malar rash, which we see which presents on the face. and it's commonly termed as the butterfly rash. And in terms of quality of life, or lupus does affect the overall quality of a person's life. It affects one's relationships, daily responsibilities, finances, and overall the ability to enjoy life. The studies have shown that it is estimated that about $50,000 is being spent by a person with lupus indirectly or directly. And these figures might be even higher in cases where a person has conditions like lupus nephritis or more severe or active lupus.
Wendy, I wanted to kind of turn to you, in regards to awareness. You're Director of Care and Support Services at the Lupus Foundation of America. I was kind of curious as well if people often get misdiagnosed, not with lupus, but misdiagnosed with other things before they learn that they have lupus. The idea is it something that people miss because they're so focused on symptoms rather than the overall effect on a person's body? Or is this something that people are able to catch? Are doctors actually following up in a way that kind of says, let's check, let's just make sure this isn't lupus?
That's a wonderful question. And yes, lupus is often misdiagnosed. In fact, it takes an average of 6 years to correctly diagnose people with lupus because people are often being treated for symptoms, not knowing the underlying systemic issue is that lupus is happening. And so it's very, very important to have conversations with your doctor to track symptoms. And then even on the medical side, we need more education among our medical providers. And that means multiple types of medical practices our specialties need to be educated on lupus. And so it's really difficult to diagnose. People see an average of 4 or more doctors as they're going through their journey trying to understand what's happening. And as Khadija mentioned, it can present itself in many different areas. And so there's not a specific pattern. It's very unpredictable. Symptoms can come and go. A lot of times people don't believe people with lupus because, at one moment they may see something happening, and then when they get to the doctor, it might not be there. And so one of the biggest challenges of living with lupus and diagnosing lupus is that people aren't often believed. And so it's very frustrating to make it to a diagnosis. And so, it takes several different pieces to put together this puzzle for diagnosis.
Dr. Khadija, I was also kind of curious in regards to medical education, educating medical providers in the idea that how does one go about, I guess from a standpoint of diagnostic approach, how does one then go about saying, this just manifested this, and this could be a whole bunch of things, and sometimes you ameliorate the symptoms of the situation. You're actually able to get something under control, and then you move on. How does the patient stay informed enough to be able to ask the doctor, I don't want to tell you your job, but can we do some more tests? And how does the doctor say, this might just be this one thing, but let's go one step further? How do we get people to a point where both patients and physicians are comfortable kind of talking about that in regards to making sure we get ahead of the curve here? Because the question I actually do have, the follow-up is, if caught early enough, is that quality of life immensely improved by realizing this is happening?
Great question. Thank you so much for that. Yes, it is very important to catch symptoms early and to treat them appropriately. So while it's hard to diagnose lupus because, as Wendy mentioned, there's several factors that doctor may look at when diagnosing lupus. The hardest part is there isn't a single test for the diagnosis of lupus, unfortunately, and this disease has no cure. So the doctor will look at several factors, in putting the pieces. It's like putting pieces of puzzle together to come to a conclusion that, okay, this person is confirmed to have lupus. For example, the doctor will look at their family history. If a person has a family history of lupus or any other autoimmune disease, this automatically increases their risk of developing conditions like lupus. What are their presenting signs and symptoms? What are their medical history? What kind of medications they're taking? And in some instances, even certain lab tests may need to be done, like biopsies. A piece of the skin or organs like the kidney may need to be examined under the microscope to confirm if lupus has affected these organs. And again, yes, it is very important to have an open communication with your doctor for your doctor to be able to manage a patient well. And this can happen in instances where the patient should be able to document symptoms or any new symptoms they notice as they happen, any side effects of medications they notice. If they need to, we recommend them taking another person with them so that they take all the information they need and they make sure they understand all that was communicated between them and their doctors. And we highly recommend that they make sure that before they leave the doctor's office, there is a clear understanding of what their medication is for, how they should take that medication, and the side effects they should expect when taking that medication.
Thank you for that, Doctor. Wendy, that opens the door too, since you do so much work with care and support. I was kind of curious in regards to once the puzzle has been solved, once the pieces have been put together, how do you talk to the families of these people? Because lupus, there are a couple of other diseases I'm thinking of right now as well too, where people aren't believed. People often are suffering and kind of dismissed. How do you then sit down with not just the patient and their prospective long-term care, but how do you talk to the people who care about this person about how they can create an environment and a situation that allows this person to have the best quality of life moving forward?
That is a wonderful question, and it's so important because lupus doesn't just impact the person that's been diagnosed. It really does affect the whole family because, as Khadija alluded to with the symptoms, for example, feeling extremely tired. That's not just, I've worked all week, I've been running around with the kids. It's basically you can rest and rest and rest and not recover. And so, 1 minute you can be fine, the next minute you can't. So it's really important to open that dialogue because people often don't understand why there's not a consistent issue going on. A lot of times these issues aren't visible, but it could be quite, serious what the person is going through. So starting with the patient, just having that conversation saying, I'm not myself anymore. I am really having to modify what I do. And starting with those conversations, just from the patient. As far as the family, we offer a ton of support. And we've worked really hard to even diversify the type of support groups we have. We do have a place for caregivers as well because it can be frightening and confusing to your loved ones. And, it's sometimes difficult to have those conversations because people are afraid. They don't know what to expect. They can't compare their journey to other people. So it is the type of condition you have to customize and bring people on your team. As Khadija said, you need an advocate sometimes. You can't even speak for yourself. And so it is a family thing. It is, something that impacts the whole person. We open up our education to everyone. And so we want people to understand that it's not just the patient for the resources. We also have a whole nother side of our work where we are working to build education for the medical community so everyone can be educated on this and be part of it. And so when we offer education and support, we're very intentional with letting people know that they're part of that conversation too. When people go into our support group spaces, especially loved ones, we take the time to explain to them how to help someone with lupus and for people with lupus to know that you often have to explain the best way to help you. And so it is a dual type of support and education, and having those conversations are really, really important. And we do have a ton of tools that people can use, videos, articles. Our health education specialists, as we have Khadija here, can even work one-on-one. We've done family conversations, and so we're very open to supporting everyone with lupus.
Dr. Khadija, by the way, before I forget to do this, lupus.org. We can make it really simple, lupus.org. You can also find them on Facebook at the Lupus Foundation of America, one word, and on Instagram and the X, formerly known as Twitter, at lupus.org. Lupus, O-R-G, is where you can get a lot of this information. One of the most demoralizing things about a chronic illness, regardless of what a person is suffering from, is that feeling bad all the time really saps your emotions, really saps your spirit, really affects your mood in terrible ways, which of course then becomes a cycle. It becomes this kind of brutal cycle of you feel worse, so you're mentally declining. The mental decline actually accelerates the physical benefits. Are there ways to kind of remediate that from a medical standpoint, from a physical standpoint? Some of the idea of being tired all the time. There's nothing worse than that, because when you can't find the strength to simply enjoy a holiday meal, when you can't find the strength to enjoy a young person's, graduation, all of that stuff wears on you. What medical remedies are available to keep these people feeling as good as they possibly can and to keep their spirits up?
Thank you so much. That is a very important question, because fatigue is one of the most commonly complaint symptoms of people living with lupus. So when we say fatigue, a lot of things might cause fatigue. So it's very important for the doctor to first and foremost evaluate what is causing that fatigue, because it might be lupus itself, it might be certain medications, it might be conditions like hypothyroidism, anemia, and so on. So first and foremost, the doctor will evaluate what is causing that fatigue. And it is very important to let the patient know to identify what triggers the flares, or that meaning increase in inflammation, which in turn can present as fatigue. So it's important to identify the triggers and how to avoid them. For instance, lupus patients are advised to stay away from UV light, that is from the sun or fluorescent light bulbs, to make sure that they are complying with their medications, to make sure they notice any sign of their medications. It's very important also to eat healthy and stay physically active. So staying physically active, again, comes back to the doctor, to have an open communication with the doctor to know what kind of activities one can engage in, because they do have fatigue as their signs of symptoms of flares. So it is important to have that open conversation so that they can be advised as to how intense or what kind of exercises they can engage in. It is important, again, to have be under the care or seek help from professional therapists. These professionals can help patients to navigate the feelings of anxiety, depression, and stress related to lupus. Another very important thing is to smoking cessation and reduction in alcohol intake is very, very important in keeping the symptoms at bay, and also learn to manage stress. Self-care isn't selfish, so one has to listen to their body, take the much-needed rest when they need to. It's hard, but one has to, do that, especially with chronic conditions like lupus.
Wendy, I'm going to ask you a question from a patient care standpoint and from a family care standpoint. A lot of people often, when someone is going through chemotherapy or going through any sort of cancer treatment, the family members will kind of take the burden on with them. Heads will be shaved, sacrifices will be made. In many ways, from what Khadija is saying, what the good doctor is saying, is that the suggestion is you don't want to put things that are going to cause inflammation on top of a condition that already causes inflammation. And so I was kind of wondering if one of the best strategies is that that family members, friends should really kind of watch what they eat around them too, to make sure that there aren't things in the house that are going to cause inflammation, to make sure that they're not creating a lifestyle around the person that is doing that, and to kind of embrace not the sacrifice, but the journey, to kind of change their lifestyles a little bit as well to accommodate this person and to make a little bit more room for their joy. Is there something to that?
That's a beautiful approach to supporting someone with lupus. Now, I do want to say there's not a specific lupus diet, but people do have to look at the specific way lupus has manifested itself. And you have food allergies, if you have specifics, and you do have to customize your eating habits and even your exercise. A lot of people with lupus have often been athletes and very active, and then, sometimes you can't even get out of the bed.
Right.
And so it's a huge change. And having a home and a support system that is sensitive to that is definitely something that would be helpful. With lupus, it can be quite isolating because you can't often do what you used to be able to do. You might lose your ability to work. You might not be able to surf anymore. You might not be able to run that marathon that you loved. And so having a family or a support system that embraces that and is kind of with you in this fight is just a wonderful thing. And it does play a part on not only your physical well-being, but your mental well-being, because a lot of times you don't know which way to go, who to turn to, and it's just wonderful to have family to embrace you. And unfortunately, a lot of times when people are in this diagnosis, they find themselves kind of moving through the journey alone. And so that's why we're so big on support and education, and even empowering people to realize that, if it's not their immediate family, to make a friend that lives with lupus so that you have someone that understands what you're going through. And so, yes, that is a big impact to have support in this journey and have people join you in making those decisions that are most helpful and most healthy, because it can be difficult to look around and feel like you're missing out or, you're just different.
Doctor, I was really curious about this too, because for the longest time, there were a lot of people who were sufferers of this, 30, 40, 50 years ago, where it was told, you're just a hypochondriac. I mean, there's always something wrong with you. And, of course, that wears down so much on people's souls. We're now at the point now when those words get said and the doctors have put the puzzle together, that there is a certain level of, I don't want to say relief, but at least a sense of, okay, now we understand what this is. Do you find that there is still a struggle to help more people understand that this is something that, that a lot of people don't have a full grasp on? Or are we still at the point now where people, when you say lupus, kind of look at you and go, what? Or do you feel like we're reaching a point now when you say it, the weight of that word hits more and more Americans with an understanding of what we're dealing with here? Am I being clear about the question?
Yes.
Yeah, I mean,
thank you. Yeah, I do understand the question, and I believe now more than ever people are being more aware of the condition, and we're so happy and excited to say that there are people with lupus are living healthier and longer lives, all thanks to education, awareness, and research. And while there is no ultimate cure for lupus, there are treatment options available. So when the doctor put these pieces of puzzles together and comes to a conclusion, okay, yes, a person has a confirmed diagnosis of lupus, there's certain things that the doctor looks at before prescribing treatment to a person. The treatment plan definitely depends on a person's age, symptoms, general health and lifestyle of a person, because as I mentioned earlier, it is a heterogeneous disease. Not two people with lupus may present with the same symptoms, and it depends on the organ system affected. But ultimately, the treatment goal remains the same. And the treatment goals for any doctor treating a lupus patient is to control symptoms like the joint pain and fatigue, to reduce the overall inflammation that is being caused by this disease, and to reduce or suppress the overactive immune system, because in lupus, the immune system is overactive, and to prevent flares before they even happen and treat them when it does happen. And ultimately, the end goal for any lupus treatment is to prevent or minimize organ damage.
And provide a better quality of life, which it sounds like both of you guys are doing. Dr. Khadija Dantata has joined us this morning along with Wendy Rodgers. The good doctor is a health education specialist at the Lupus Foundation of America. You can find them at lupus.org. Wendy is the director of care and support services of the Lupus Foundation. You can find them on Facebook at Lupus Foundation of America. That's one long word. Or on Instagram or on X, formerly known as Twitter, at lupus.org. Please check them out, guys, and please educate yourself on this. You probably know some people who have it and just never bothered to ask or find out. It's really important to get on top of this and to make sure that more people are aware and make sure that the people who have this condition continue to have a better quality of life with better outcomes. Thank you both for making time for us this morning. Really appreciate it.
Thank you. Thank you for having me.
Thank you.